Good morning, everybody. I'm Chris Humphrey, the Executive Director of the EU-ASEAN Business Council. Welcome to this launch event today for a report that we, together with KPMG, Singapore and Sanofi, with the support of the Western Pacific Pharmaceutical Forum, are publishing today on the decade of healthy aging in ASEAN and the role of life course immunization. We will have a panel discussion a bit later on in this session. Once I finish with these brief intros, Chris Hardesty, a good friend of the council and the lead at KPMG for healthcare issues here, will give you an overview of the paper and the work that's gone into it and the recommendations that have come out of it as well. If you have any questions at all for the panel, you can use the Q&A function at the bottom of your screens and we'll pick up the questions from there. But to kick this off, we will be showing you a very brief video that we prepared, which summarizes what the report's about and the reasons why we did it. So I will share this with you now.
Even more important than this for us in this report and for Southeast Asia is to look at this dividend that countries can harness by having a healthy, productive working population. So if we're not careful here and make the right policy actions, then we'll miss this kind of demographic dividend and longevity dividend concept that we highlight in the paper.
And why is healthy aging so important? I think developing a system of life course immunization for our elders in much the same way we have immunization for children will help maintain their health and their well-being into their old age. And for the region, it will help, hopefully, to avoid the middle income trap that many countries might fall into. It will keep our elders and seniors economically productive and less of a burden on health system and less of a burden on their children and grandchildren as well going forward. And that will help with society's long-term economic development and societal development.
So population aging is shaping societies all over the world. So with age comes an increasing susceptibility to diseases like flu, pneumonia or COVID-19, which creates an increasing burden on the health system and at the end of the day, a cost for societies. So I believe that this must be integrated in the health system in Southeast Asia. And one key lever for healthy aging is life course immunization.
Of course, over your lifetime, there are many different vaccines that you might need, that you might benefit from, and your pharmacist can give you valuable advice about these. What's the most appropriate vaccine for you? When should you have it? What does it mean in relation to the other medicines that you are using? What should you expect in terms of possible side effects and how to treat them? So there's a range of things that pharmacists can do for you in relation to when and what vaccines you should have.
Yeah, that was a good summary of why we've done this report. And with that, I'll hand over to Chris for his presentation as well.
Many thanks, Chris, and to the EU-ASEAN Business Council, as always, for convening such a forum. I hope everyone out there listening is taking good care. I saw we had registrations from about 18 different countries representing government to academia and research to various industries to media. So thank you all for joining and taking part of this initiative. As Chris Humphrey has said, this is a four-way partnership between the Council, KPMG, Sanofi, and the Western Pacific Pharmaceutical Forum. So we'll get to hear from all of these stakeholders as we go, as well as some other distinguished guests who we have here today to be part of the discussion. You know, as I'll get into in a minute, these ideas of healthy aging as well as immunization, these are very topical things to discuss, I think, on all of our minds. But not only from a policy perspective, I hope that all of you listening, it's a very personal matter these days, whether it be looking after ourselves or looking after our loved ones. I think the last couple of years have taught us a lot about these two topics. So very timely for the discussion, and thanks again for tuning in. So the way the agenda is going to work, we'll have some introductory comments just about why we've undertaken this program. We'll dig into the research findings a little bit, but we'll try to keep that pretty brief because we'll be able to share the report with everyone to have a read, and then really get into the panel discussion. So you're encouraged to, you know, put your comments, put your questions out there. I saw one already about, you know, classical, is this going to be recorded or is the content going to be shared? I think the answer to that is yes. So we've already taken one question there as well. So with that, I'm going to call up my screen and we'll just start digging into the content here. So as I said, I'm going to explain a little bit about why we've undertaken this initiative, and so that you can hear from some of the other stakeholders, and then we'll get into the report findings themselves. So as I alluded to a second ago, there's two very fast moving trends here, right? One is what's been declared as the Decade of Healthy Aging by the United Nations, and that's being executed by the WHO. So the Asia Pacific plans for the Decade of Healthy Aging are already available. And here we focus on topics like the rapid aging populations in our region, better care coordination, better tech adoption, better surveillance of our society. So that's kind of one initiative moving forward. The other concurrent initiative on the same timeline, though, is the Immunization Agenda 2030. And so here we look at the topics of preventative health, better vaccine equity in our societies, building up our immune systems, and just overall this kind of idea of having immunization be a life course journey for people. So I think really the point of this paper is how do we do a better job connecting these two fast-moving trends to each other to enrich the overall outcomes of the policies that we're putting in place. So that's the real essence here of what we'll be discussing. And so we've done a literature review. We've been in the field for the last 6 months in Southeast Asia, speaking to different stakeholders across the ecosystem. And today is the launch of the report. And then over the next 4 to 6 weeks, we'll be conducting some country level dialogues as well. So I encourage everyone to get involved in those discussions. And then really the goal is not to stop there, it's to, you know, think of these actions and be concrete such that we can continue to derive the public-private partnerships on these actions going forward. So that's a little bit of the impetus there. And why do we feel like this is a good time? A few reasons. First of all, like I said, I think the last couple of years, COVID-19 has taught all of us about the vulnerability of our elderly population and the need to ensure they have proper immunity in order to have longer, healthier lives. You know, secondly, and as I'll explain a little bit further, we are rapidly changing our demographic makeup in Southeast Asia. And so we have an opportunity now to look ahead at what some other countries have done and to better prepare for this through effective policy around preventative techniques like immunization. And then thirdly is if you take the above 2 points as true, you know, the reality is there is still an insufficient lack of life course immunization policy across Southeast Asia. So that's what we need to focus on ramping up. And that includes the cost effectiveness of investing in proper preventative techniques like immunization. So this is where we'd like to see a better job of connecting the healthy aging agenda with the immunization schedule agenda as well. So that's what we feel like this is a good time for the discussion. And as I said, I think for all of us, this is quite a personal topic these days. But with that, before I get into the content of the report itself, I'd just like to call on a couple of other people who have helped to kind of champion this initiative to share their remarks with you. First, I'll call on Ada Wong, who's the Sanofi Asia Public Affairs Lead. She's also the chair of the EU-ASEAN Business Council Healthcare Committee. So Ada, would love to hear your remarks, please.
Thank you, Chris, and good morning to my fellow panelists and participants here. The discussions we're having today on healthy aging is very close to my heart. I'm in my 40s and I'm a mom of 2 young kids who are still elementary school. So my husband and I want to make sure that we stay healthy and active for our kids or our grandkids long into the future. For the personal reasons aside, as you will hear from my fellow panelists as well, aging is a global issue and there's no exceptions for this region. By 2050, 62% of Asian population with makeup of the older adults, making Asia is the oldest regions in the world. As for Singapore alone, as highlighted in the latest Singapore census released early this month, the proportion of age 65 and above in Singapore increased from 9% in 2010 to 15.2% in 2020. Healthy Asians for me is how to better embrace the concept of prevention, how to have a healthy lifestyle, diet, and take good care of yourself. Compared to the States and Europe, the holistic concept of prevention is yet to be fully endorsed in many countries in Asia, including ASEAN. As Chris mentioned, taking elder immunization as example. When we get older, our immune function declines with age and increase our chance of getting vaccine-preventable diseases, such as flu and pneumonia. And vaccination has been recognized by the World Health Organization and many medical professionals as one of the most cost-effective and efficient method of disease prevention. In order to maximize the benefit of vaccination, it is important to take the life course approach. And yet, elder immunization is not widely adopted across ASEAN. Elder vaccinations rate fall well below WHO target of 75% across this region. With diseases like flu and pneumonia come an increased risk of health complications. The quality of life of our elder population could be severely impacted, as well as the drive of the healthcare and economic costs. With the COVID-19 pandemic, as all we know, there's a growing awareness of vaccine and vaccination. Policymakers could take this opportunity to incorporate life course immunization as part of the healthy aging policy and partner with the multi-stakeholder to further drive the awareness and the delivery. And thank you again. I look forward to the fruitful discussions. Back to you, Chris.
Thank you, Ada. And let me call in here our fourth stakeholder, helping to guide this paper. So we've got John Jackson dialing in from Australia, the president of the Western Pacific Pharmaceutical Forum, and he's also a project pharmacist director at Monash University. So John, we'd love to hear your remarks as well, please. Thanks.
Well, thank you, Chris, and good morning, everybody. It's a great pleasure to speak to you today about this program on behalf of the Western Pacific Pharmaceutical Forum. The WPPF aims to enhance pharmacists' practice and the use of pharmaceuticals, such as vaccines, throughout the region. Look, there's no better place to start than with what's happened over the last 18 months, and there's two things we can learn from the COVID pandemic. First is that viruses are continually evolving and are a never-ending threat. But the second most important thing is that they do not respect national borders. They may affect our countries differently depending upon a range of factors like our demographics or our health systems. Consequently, what we need to do is to learn from each other, to learn what diseases may potentially mean for each of us, to learn how we may best respond to those diseases. What are our options and what are the likely successes? And in particular, we need to learn how to use immunization to help people live both longer and better lives. And so WPPF is, as I said, extremely pleased to be able to support this program, and very much looking forward to the discussions today. Thank you, Chris.
Thanks, John. And I know you've spent a lot of time in Southeast Asia yourself, so looking forward later to drawing some of those parallels, for the region too. Okay, well, now you've heard from all the kind of hosting parties here. So what I'll proceed to do is just share some of the key points from the paper with you, and then we'll welcome in our other distinguished guests and get the panel dialogue going. So again, please feel free to put your chats or comments, thoughts, questions into the chat, into the Q&A function. Okay, so as has already been alluded, I think one of the main points here is we need a bit of a wake-up call on what is happening around us from a demographic perspective. And there's a lot of messaging out there on this, so I don't think this is totally surprising to people. But if you look at Southeast Asia, we are still a relatively younger population as compared to some other developed countries around the region or around the world. But we will all officially be aged societies by 2050, where over 20% of the population is above the age of 65. I mean, if you look at some countries like Singapore, that will be 40% of the population by 2050. And in fact, even within the next 5 years, the number of people who are above the age of 65 will be bigger than the number of people under the age of 5, which is the first time that's happened in our population's humanity. But the point here is not just about people living longer, it's also about making sure they have a healthy life expectancy as well. And as you can see in Southeast Asia, the current average life expectancy is around 71 years, which is already about 10 years behind some developed countries. But if you add on top of that the quality adjusted life years, the disability adjusted life years into what is considered a healthy life, actually it's only around 61 years that people have. And so in some other research, KPMG, we've estimated that every average year of healthy life expectancy of a population contributes an additional 4% to your GDP. So, there's a lot of economic loss here by effectively not intervening to ensure people have a healthier lifestyle. And so I think one key concept to understand as part of this paper is we have this dividend opportunity in our region, right? Which is we're coming out of a period by which there are more people working and contributing into productivity and GDP than there are dependent on those people. But that will soon flip as our societies age. And so are we going to put in place the mechanisms now by which to extend out that dividend period, known as a longevity dividend, by making sure that our elder populations are healthy, they continue to be productive contributions into society. So that's a bit of the economic wake-up call in addition to the demographic one here that we're highlighting in the paper. And again, we'll dig into immunization, but you can see immunization is a classic cost-effective preventative technique to ensure that the healthy lifestyle and the longevity dividend can be harnessed. So if we dig in just influenza vaccination as an example, as an illustrative example of what I'm talking about here, the role of immunization in all of this, you can see here how Southeast Asia compares in terms of adult immunization rates as compared to other countries and regions around the region and around the world. And in Southeast Asia, none of the countries meet the 75% target that is set by the WHO. So we have a long way to go. And I'll just dig into some countries in particular. So if you take, Singapore, for example, pneumonia is the second leading cause of death now, and it causes 157,000 lost workdays each year. But yet you can see the adult immunization rate is quite low. Or even in Philippines, where vaccines are basically free, but the lack of education and awareness in the public and in the practitioner community are a barrier to progress. And then other countries like Malaysia, Indonesia, and Vietnam simply don't even have an adult vaccination schedule, which is why the rates are so very low. And so in this paper, there is an overarching barrier we identify, which is the lack of integration of adult immunization policy with healthy aging policy. And as I said earlier, that is at a very macro WHO, UN level, but also needs to trickle down into the country level. And so because that type of integration of a policy framework doesn't exist at a country level in much of Southeast Asia, we see delivery barriers in terms of low awareness and a lot of vaccine hesitancy by people and by practitioners. And then as a result of limited coverage for adult vaccinations, there's a lot of expectancy on people to be able to pay for that out of pocket, which, as we know, in Southeast Asia health systems is really not the solution to take forward there. And just as an example, if you take flu shots, right, it's estimated that an effective flu shot campaign program can reduce all-cause mortality by 47% and have a 51 times ROI. So there's a definite economic opportunity here to intervene earlier. And I think one underpinning thing to all of this is as well just the data aspect, right? We just simply aren't surveillance and strong enough surveillance to be able to capture the data we need to monitor these changes and to basically inform policy. So these are the barriers we've identified in the paper, probably not a total surprise to people out there. And now what I'll do is talk about some of the policy solutions that we have in mind to overcome these barriers. So we have three sets of policy solutions. One is at the government level, one is at the corporate level, and then one is at the citizen level. And I'll just summarize those and then kind of wrap up and shift into the panel discussion. So a few opportunities we see from a kind of very tactical perspective at the government level to better integrate healthy aging policy with national adult immunization schedules. One is just really beefing up the healthcare practitioner community to be advocates of this whole process, right? I talked earlier about some issues in places like the Philippines where there's not enough advocacy at the practitioner level. And this can be done by making sure practitioners have the effective tools that they need to be advocates, but also in some other countries like the UK, we've seen where actually practitioners are incentivized financially to support the adult immunization schedule. So there are various techniques here that can be used. I think secondly is just to amp up the way that we do the surveillance data mechanism of our population epidemiologies and demographics, and the cost benefit around investing in preventative techniques like life course immunization. So I think that's something that we can all agree with and needs to continue to be invested in. And then just making things easier on people to get their immunization by bringing it closer to them. So a study done in Thailand, for example, of all the dimensions that would provincially prevent or encourage people to get an immunization, convenience was identified as the single most important factor. And so we look at, for example, Korea. What they've done is they've allowed the public national immunization program to be administered by private sector locations, and thereby expanding access to coverage points. So there's some good tricks here that can be leveraged. And then finally, if we're able to kind of effectively move the needle on the above, then that should put us in a position to get a little bit more predictive around the way that the supply and the demand in this space needs to work through predictive analytic techniques. And just as a kind of incentive here to governments, what this could mean is better long-term, planning and contracting with vaccine suppliers of services and products, such that you can actually kind of better anticipate the needs season to season and year on year. So that's a little bit of the opportunity here that could be harnessed by the governments. And then if we look at the corporate level, a couple of just kind of relatively simple, straightforward things, but just don't happen often enough. So one is the role of the employer in all of this. And that can be by both championing vaccine awareness and education and seasonal kind of campaigns that can still be run through public-private partnership, but also making sure that the corporate wellness programs have sufficient coverage and access for employees to have the convenience and affordability of vaccines as part of their employment as well through the companies. So that could be a really great opportunity for Southeast Asia, for corporates to get more involved in this program. Secondly, and as part of the EU-ASEAN Business Council, there is an insurance committee too, private medical insurance. And as we've seen during COVID-19, there's a lot of thinking here now about how the role of private insurance can kind of step in and support some of these coverage gaps, both in terms of people being able to access immunizations, but also coverage and protection against some of the potential side effects there. So I think this is a conversation that continued to be had and a lot of activity around it from COVID-19 as well. And then finally, we just wanted to highlight in this paper the role that everyone on this call has as citizens, a few things that we can do. So one is just to continue to be advocates ourselves out there of championing the message and being a positive word of mouth about the role that life course immunization can have to our societies. And so if we think about life course immunization from a policy perspective, we can think about it from a messaging perspective too, in terms of tailoring to people's needs as they go along the journey and making sure the messaging is appropriate for their particular stage of life. So we see a role of social media and other kind of mechanisms here that can really help in this perspective. The other thing, as I said, is just making sure it's more convenient for our elderly communities to actually get access to the vaccinations. And so in the US, for example, they have the mobile clinics, or in Singapore, they do administration through the elder care homes. So there's some good models here that other countries in Southeast Asia can leverage. And then finally, just recognizing that the elder population and the adult population are increasingly digitally savvy. So how can we kind of harness that from the perspective of life course immunization too? And it could be everything from making appointment booking a little bit easier, but also amongst the sponsoring parties of this paper, we talked about the risk of misinformation and how if we don't kind of effectively use digital tools to inform people of proper information around immunization, and then the risk of them getting misinformation through digital mechanisms is also quite high. So we need to really think seriously about sort of combating that too. Okay, and then in the paper, we've manifested all these ideas into some kind of tactical policy actions. So this is done at a kind of regional level, but then we provide country level snapshots in the paper too. But some of the main themes, and again, I've touched on this already throughout the presentation. So one is just integration of the healthy aging policies with something like a national adult immunization schedule. It just doesn't exist quite extensively enough in Southeast Asia. Governments will need to think about how they can provide free or subsidized, vaccines as a mechanism to encourage uptake, at least initially. And this, again, can be through public-private collaborations, like with employers and private medical insurers as well. And then some of the financing, in order to allocate those subsidies could be things like having a more tailored health technology assessment toward vaccinations. We look at more novel financing vehicle concepts that are already in place, such as health savings accounts that we have here in Singapore, even things like send taxes that exist in markets like Taiwan. So there are some mechanisms for how you can finance the suggested subsidies of free vaccination to populations. And then, as the kind of role of private insurance can pick up in this space, you can offer things like tax deductions to encourage people to take out proper policies here too. And then I think if we're able to really make some progress here on these first three items, then we can start thinking about not just the elderly population, but also into more of the people in their 40s and 50s, and starting to encourage that messaging and life course approach earlier on, so people are already kind of accustomed to this journey as they get to that elderly segment of their life. So that would be another great ambition from a policy perspective for Southeast Asia. So as I said, we've got country level snapshots in the paper itself. These again are kind of some things that I've already covered, so I won't repeat that, but it summarizes some of the ideas at the government, corporate, and citizen level that could occur. So officially after this, we'll be releasing the paper. We'll have those country level dialogues going on. So I encourage everyone to get involved and to share your ideas. And we will launch an official website that's got all this collateral and videos and other kinds of things there to stay engaged with the topic as we go on this journey over the next decade to really put the proper policy in place to harness this longevity dividend, rather than to kind of be caught waiting around or to not use preventative health techniques properly enough as our demographics are changing. So I hope everyone found that interesting, probably some things that you knew, some things maybe that could be a bit different, and I look forward to hearing your ideas and comments as we kind of move through the panel discussion too. Okay. Well, with that, what I'd like to use the rest of the time for, we've got a good kind of half hour before we wrap things up, is, we've got John, Chris, and Ada still here, part of the discussion. I'd like to call in a couple of other distinguished guests to introduce themselves and make a couple of remarks, and then happy to take questions from the audience or to just engage in a bit of dialogue here, as we've got very different perspectives and stakeholders on, which is wonderful. So let me welcome in our next two kind of distinguished guests here. So first I'll call on Janice Chia, who's the Aging Asia Managing Director. She also holds a lot of innovation kind of roles around aging around the region, so various perspectives there. And maybe Janice, you can talk a little bit about what you're doing. And I think we were very keen to hear from you on how private sector can work with public sector on something like life course immunization. So Janice, your remarks, please. And you are muted, sorry, I have to say, yeah.
Hi, thanks for having me. Thanks, Chris. And thank you very much to everyone on the panel. Aging Asia is the first industry alliance on the business of aging. And our focus really is to bring international knowledge transfer about all the best practices in elder care models. We also look at market trends on the aging population. Apart from Aging Asia, I've also started Aspire 55, the first virtual retirement village. So across the board, when we look at trends between the industry as well as consumers, the focus today is really about health longevity, living longer, living healthier. And I think life course immunization is a very big factor. I mean, in Singapore, the immunization rates for COVID, we've seen the seniors respond very positively to that. Understanding the side effects of all immunizations it's a normal part of today's very knowledge-driven senior. They'll Google, they'll look at all kinds of channels, but they'll make an informed decision once the information is laid out in front of them. So I think that is that changing demographic of baby boomers as well. So they are more educated, well aware, and they're looking at ways that will help them towards aging in a better way. They've seen their past generations, the seniors they've looked after in the past, age in a way that they don't want to age, perhaps. They've seen, grandma and grandma's mother age very dependent on the children. But today's seniors are going to be very, very independent. They want to be enabled as they age. And I think health is one of the ways that they're going to feel that biggest impact. To be understanding of the best practice models out there for them to age better. That's really important. Regarding more public-private collaborations, I think that is the future. We've seen in many different countries, especially in also in the UK, in Australia, there are public-private collaboration models that are very successful. A lot of it points to, let's say, the senior living facilities, for example, where we see public and private work very well together with the council in order to deliver the land or the buildings. You don't need to say that aging is going to be one fix for all. So aging is consisting of many, many niche areas. And in every niche area, we're going to be able to establish new partnerships. And I think increasingly the focus in a more, in a different kind of world today is how can we fulfill private need as well as social needs. So we see many models where in order to cater to the lower income or seniors who are needs-based, it's also supplemented in the model by catering to a luxury base. And within these two, that's where you can achieve an equilibrium and to be able to divide the resources to all who needs it by being able to target these niche industries. So I think that is definitely one of the key trends of the future.
Great, and yeah, I think you summarized well why this idea of life course is key, because people are on different stages of their journey, and it really has to be a kind of tailored approach. So you summarized that quite well, and how the private sector can be involved in this. Thank you. Okay, and last but certainly not least, we've got Professor Brian Kennedy here with us, who's the director of the National University Singapore Center for Healthy Aging. Brian, would love to hear more about what you're working on, and also I think in particular, the role of preventative techniques and what that has the opportunity here for something like healthy aging. But I won't be too prescriptive, so over to you, Brian, for your comments. Thanks.
Well, actually, this is a great panel discussion for me because you've all made all my points for me, so I can talk about the Euro 2020 or something. I think it's great to hear all of this, and the white paper is fantastic. And I look at immunization as part of a bigger picture, really and I think the key word you used in that was life course. We need to rethink how we do healthcare. We're spending too much time doing sick care and not enough time focusing on keeping people healthy. And, preventative medicine is the key there, and the challenge is how to implement that in a much broader perspective. And vaccination is actually a key pillar of prevention. So I think it's important to emphasize that, particularly in these times. I don't need to reiterate that the biggest risk factor for mortality from COVID-19 is by far aging. I mean, independent of diseases of aging. So we don't really understand all of that, but it just reinforces the need to keep people healthy and focus on health span. What we're really trying to do is to look at interventions in the 50 and 60-year-old population that will take people that are still healthy and keep them healthy longer by slowing or reversing aspects of aging. And already some of these interventions are being tested in terms of their ability to improve vaccine response. And so one challenge with vaccination in the elderly is they don't always respond particularly well to the vaccine. So we're fortunate with COVID-19 in the sense that the response has been quite well in the older population in terms of their body's response to the vaccine and producing antibodies, et cetera, that combat the virus. But with influenza, it's a little more challenging. So there's also a need to do better research to understand why people lose the ability to respond when they get older as well. So I think there's a lot to be done. What we'd really like to focus on is how do we target the basic mechanisms of aging to keep people healthy, to keep them from getting chronic disease, to maintain their functional capacity, and to come back to another keyword that was mentioned, to enable them to be active and productive later in life. And I just finally like to point out that I think there's a real role for private sector, public cooperation in this as well. We work on the academic side with cost-effective strategies to measure how fast people are aging and to do interventions. But we're also working with the private sector to look at more expensive technologies to see if they really work, because if they do, then we can figure out ways to make them more scalable. So there's a lot of challenges, but it's nice to hear that there's an increasing awareness of the needs of the aging population and the importance of working with people before they get sick, because it's much more cost effective and it improves quality of life much more.
Wonderful. Thank you, Brian. And just to put a bit of a plug, I think you have your weekly longevity series. So I encourage everyone to check that out. You cover quite a number of good topics there as well. So
Yeah,
put a bit of a
go to
plug.
Healthy Longevity in US. Sorry, I don't make any money, so I can plug it.
It's great. I've attended many of them myself, so I encourage everyone to check it out. Okay, so now you've kind of heard from the various perspectives here. And again, feel free to put your comments or questions in the chat. But with that, I think I'll just kind of come back to some people here on the panel and just ask some very targeted questions so you can hear from their views. So I'll just kind of make my way around a little bit. But John, maybe I come back to you. So, if you look at Asia Pacific, right, Australia really is a leader in national immunization programs and just kind of awareness, right? So obviously a lot of good stuff going on in Australia, but equally you've spent time in Southeast Asia. So just wondering, maybe you can draw some parallels here between what you've learned in Australia and what you think Southeast Asia can benefit from.
Thanks, Chris. Well, as I said in my earlier remarks, I think there is a great opportunity. No, I'll change that. I think there's an absolute need for us to learn from each other. And the learnings go both directions. There are some lessons that I could point to from Australia, strengthening immunisation beyond just a conventional childhood immunisation program into something that really engages the adult population was able to be facilitated by addressing influenza. It has proved to be a very useful entry point into a wider immunisation program to get the population aware of the benefit of immunisation. Immunisation sits at that very, very interesting interplay between personal health and public health. So by being immunised, I gain a personal benefit. By being immunised, I give a public benefit to the wider population. And so it is in some ways very different, unique, I suppose, compared with a lot of other healthcare. We do have to share from each other. Some of the tasks that have been used, broadening the touch points for the public as to where they can gain immunisation. As soon as we moved away from the conventional childhood immunisation and wanted to get a bigger part of the population immunised for influenza, not just those who are unhealthy and seeing doctors, but those who are healthy and want to obviously gain the benefit of immunisation, we had to open up other points of immunisation, greater access. And speaking from my profession's point of view, this is one place where pharmacy came into its fore. It was able to provide immunisation services to the public who perhaps had no reason to visit doctors and so wouldn't become aware of a need for immunisation through a medical consultation. So there are things to learn from each other. I think there's another thing though that is very challenging to demonstrate. We know that immunisation is probably the most effective and cost-effective health intervention. But you've got to prove that cost effectiveness in each environment because they're going to be different. There's different economics in each environment, different levels of working population, different income levels. So what we can learn is how you do those studies to prove cost effectiveness. The vaccine is going to be relatively effective in all populations, but its cost effectiveness, which will convince the funders, convince the regulators to get behind it, may vary country to country. The methodology of the research might be similar, but the research has to be done in each country. Back to you, Chris.
Super, thanks. And I think there was a question that came in while you were talking about kind of how we activate, people's, education and motivation too. So I think you touched on how to make that process a bit easier. And maybe Ada, I can bring you in on this one too, because I wanted to come to you anyway, and it's sort of related. So, what is the role of a pharma company in all this, and any kind of best practices from the campaign perspective to get people kind of activated on this?
Yeah, thanks, Chris. I think the question from Jonathan is a very good question. In fact, we all know that vaccine doesn't save life. It's vaccination. And I think that the education's divided into different levels. You have individual level, you have society level, you have country level. What John shared earlier is the cost effectiveness is very important information that we need to share with the policymaker. We need to share with the regulators. HTA system tailored for vaccines is very important. currently most HTA system only for treatment per se. The cost effectiveness and benefit of vaccine hasn't been really fed into the system to truly understand about the value. When it comes to education, I think it's a multi-sector task. It's complex, it's complicated as well, because you have people that they truly trust the benefit of vaccines. You have people they don't like vaccine at all, or the vaccine hesitance, etc. How can you bring people from one side to the other? It's a huge task for every single government. But I do believe that the education, continuous education's awareness campaign driven by multi-sector such as policymakers, NGO, academia, healthcare professional is very important. From pharmaceutical company like us, Sanofi, we do partner with different sectors, academia, healthcare professionals, and NGO, to continue to bring that message, the science-based information, accurate information to our external stakeholder, to raise awareness about the vaccination. I think the good point Chris mentioned earlier as well. I like to use the term about a patient journey or customer journey. That's no different from all FMCG company. You need to understand your target audience. What kind of message can relate to them to educate and bring the value to them? I think that's very important.
Super, thanks. And if anyone on the panel wants to jump in on some of these things, please feel free to do so. Maybe Chris, Humphrey, I come on to you though, and it's kind of something that Ada was just referring to, right? So if we do look across Southeast Asia, I mean, there is effort, right? I mean, there's healthy aging policies, there are some national adult immunization schedules and some level of coverage for vaccines, but it's very fragmented and inconsistent, right? And you work a lot at the secretariat level to drive harmonization of many topics. And I know it's not an easy thing, right? And things take time, but you guys have as a council, driven real traction on integration of secretariat level efforts. So how can we kind of raise this up to that level and drive some better harmonization across the ASEAN secretariat of a topic like this?
That's a very good question, Chris. I mean, it's not an easy process here in Southeast Asia. And unfortunately, when it comes to dealing with health ministries, they tend to be a bit more reticent about speaking to the private sector, even when we have ideas that can help them with their overall missions. And indeed ideas that can help save them costs in the long run at the same time, as well as preventing illness. So we will continue to engage the ASEAN Secretariat. They do have a dedicated unit there dealing with health issues. There's a DSG, a Deputy Secretary General, who's focused very much on health stuff as well. And we have opportunities to raise them directly with all the ASEAN health ministers, hopefully in September of this year, and with the senior health officials. One thing I would say, I'll pick up on what Janice and John and indeed Brian was saying. This really is a multi-stakeholder approach. It's not just about us saying governments, you need to do things, you need to change policies, you need to take a more harmonized approach. We do need that the private sector as well, our members and members of other councils, to step up to the plate. The ideas you mentioned around health insurers coming up with new policy ideas, encouraging people to get vaccinations, either to lower their premiums or to actually help pay for their vaccination costs, and indeed then educating the general populace as well about the benefits of it. And at the end of the day, we all want to live longer, healthier lives, contribute more, be less of a burden on our relatives going forward. And there's an awful lot of things that can be done there. At the council, we keep plugging away on health issues. This paper, in fact, is the third in a series. As you well know, we've done one on sustainable health financing last year, looking at ways to make governments get more bang for their dollar when it comes to healthcare spending. We did one last year also on self-care issues as well. So promoting healthier living for people, easier access to help look after themselves, so medicines and over-the-counter medicines. And I think this paper today fits into that program as well. So it's all about just working with governments, continuing to bring about the message. We'll do that through workshops. We would do it through a series of roundtable meetings we do get with health ministers across the region. And we'll just keep publicizing it and talking about it more and more.
Well, we'll keep fighting the good fight out there, and I encourage everyone listening to get involved with the council, because it's a great opportunity to get plugged into these discussions. And maybe I come back to Brian and Janice now. So I'll ask you guys both the kind of same question, as I think you'll have different perspectives on it. But earlier I talked about this idea of harnessing a longevity dividend, right? So how do we, as our demographics move from a demographic dividend of the working age population to the dependent population into one of how do we kind of extend a healthy life expectancy and keep a productive population healthier for longer, such that we can harness the longevity dividend. I think both of you are working on this in different ways, but just curious your thoughts on a concept like this and what we can do to really harness that dividend concept. So I don't know if Janice or Brian, whoever wants to go first there.
I guess I'll go. I think that it has to be a universal approach. We talk about keeping people healthy longer, but we also have to keep them engaged and empowered. There's a tendency to still have retirement ages in Singapore that are pretty enforced. I tell people that if you're healthy and you're active, that's the last thing you want to do. And especially with the declining workforce anyway, I think that it's really critical to keep people engaged, and maybe they want to retrain for other jobs or go back to school or whatever, but volunteer, take care of grandkids. There's a lot of things to be doing, but we have to really start to encourage that. I think one of the things that struck me when I came to Singapore is that, I have two parents in their 80s, and they have no intention of ever listening to anything I say. And that's sort of the common approach in the United States. And that's still in Asia. There's a tendency for the younger generation to sort of be in control of elders when they get to a certain age. And I think that we need to, take the brakes off and really encourage people to be out and be more active, be more engaged, and be more aware. And so that's, we're trying to focus on the biology and the health, but I think that it's a broader challenge to re-educate the population that there's no need to stop doing things when you hit a certain age. You should look to diversify and do different things if you want, but there's lots of opportunities, and these governments throughout the world really have to start creating opportunities for people later in life.
I share the views with Professor Brian, of course, and I think age is just a number. So it's I think in this age today, it's all about helping people to age with purpose. Not all seniors will want to do volunteer work. Not all seniors will want to engage in full-time employment. As we've seen from COVID, everything has changed. The way we see full-time work, the way we see regular employment, and the same way attitudes for seniors will change. So they are going to want to they know they're going to be living longer. They have on top of financial requirements of aging, and they're concerned whether the retirement income can stretch. The other thing is, I think it's really an opportunity for them to have the time and the resources to do the things that they love. In Singapore, we've seen a lot of programs encouraging seniors to be learning new skills, taking on technology. And I think this new generation of seniors will be more tech enabled as well. And along the way, of course, they're going to be looking at how they can increase their productive contribution years rather than just looking at it as a working age or the cutoff point for retirement. These things may not factor so importantly anymore. I mean, even if the employment age was set at a certain age, if they decide that they don't want to work anymore at 60, then that's their own prerogative. Yeah. So, but it's all about their own interest. What makes them happy and passionate and want to contribute? But I think increasingly there might be birth of more measurements on seniors' contributions, and this may not be in regular full-time work that we think of, but it's also the informal caregivers that's an important contributor, and the how fulfilled they feel doing these roles. And in future it's not strictly volunteer, and there would be some kind of a payment structure involved. We hear of volunteerism points, and we hear of different structures, and I think that's all going to contribute to this new generation of seniors who are going to be living longer, and hopefully the end of life stage is as short as possible. And I think that is the end goal of also trying to promote this life course immunization strategies and to promote healthy aging.
Great, yeah, and I know Aging Asia does a great job of looking at the opportunity here, how we can kind of harness this and not sort of be scared of it, right? Maybe while you have the microphone, Janice, and probably this is the last question we'll take from the audience in the essence of time, but everyone is on the panel welcome to chime in. Quite a big topic, so I think worth discussing, and we did mention it earlier, which is just, misinformation, right? And whether that be non-vaccine related, but of the elderly population is getting increasingly into the digital tools like you just talked about, but also, of course, from a vaccine perspective as well, there's a big risk of misinformation. So yeah, I don't know, Janice, just curious if this comes across your desk and if you guys are kind of anything you're doing about it.
Yeah, we've conducted a few surveys as well as webinar awareness programs for seniors regarding, let's say, for example, just taking COVID-19 immunization as an example. There is a group of seniors that you guys mentioned before that are really against it, and it's hard to convince them. But there are also those that are on the fence, and I think with more knowledge we can get them past that on the side of pro-immunization. But knowledge is power, so it's really about access to it, and we must understand that because the senior population is so wide in Singapore, by 2025 it's about 1.8 million seniors, and different seniors from different social demographic groups. We need to have different channels to access them. I mean, we're even doing programs for them in multiple languages so that we can access the different demographic groups. Although seniors are such a large population, if we narrow it down, we really have to do a lot of personalization in terms of trying to cater to the different groups, the different niche markets.
Yeah.
Great.
I think there's personalization at the biology level too. People are aging in different ways, and there are different factors that are driving the decline in function and the onset of disease. And we need to go beyond just telling everybody to exercise and get to interventions that are really targeted toward personalization for the specific needs of the aging population. But it's also just an overall awareness that aging is not inevitable. I mean, it may ultimately be inevitable, but there's a lot you can do to influence how you age, and taking an active role, making informed decisions, giving people the knowledge they need to choose how to maximize their health is so critical. And I think governments are just becoming aware of that and really starting to take active roles in that process. And now's the time to really step up and have programs that really engage the elder population.
And I think just to add on to that, a lot of time when we talk to seniors or our own family members, they won't listen to us if we say go exercise. It's also quite difficult, but I think like the first day of school, if we accompanied our seniors as much as possible to the first 1 or 2 sessions, we could see a very big impact throughout. So if just within our own circles, we accompanied 5 or 6 of our family members, perhaps we could get them on a routine, and the investment in time could have very long-term effects.
And on this personalization point, right, if we think about misinformation, that is an incredibly targeted, personalized attack, a kind of approach, right? So we have to at least be as good as that if we're going to kind of right the ship here a little bit. So I don't know, John, Ada, Chris, anything you guys want to comment on kind of misinformation here?
Chris, I'm very happy to, because if we look to see how misinformation moves so quickly around our various countries, and again, that recognizes no borders, it's often social media. And I think we have to be smart in our use of the social media. Look, of all the groups on the screen, I think Janice's group is the most important. I think the drive has to come from the populace. It's got to come from the people. It's got to come from groups who represent the people. And they have to be supported by astute use of social media to get the right messages out and to counter the misinformation that unfortunately, as mentioned in the chat, has arisen over the last couple of months, particularly around COVID vaccination. And that does, to a certain extent, seem to be poisoning a broader understanding of the benefits of vaccination. So I'm not a big social media user myself, recognizing my age, but look, as my grandchildren get involved with it, I'm sure I'll be right up there with them. And consequently, I do think social media is a big part of this solution.
Looking forward to your TikTok videos, John. Ada, Chris, anything you guys want to comment on this topic? Otherwise, we'll start kind of wrapping things up here. Go ahead. Yep.
Just one thing to add. I think with the COVID-19 pandemic, you can see that the the policymaker actually recognize the importance of vaccine confidence. I remember in the past, probably take longer time to raise the topic to them. They may take longer time for the policymakers or other stakeholders to come out to clarify the information. Now it's very quick. Any misinformation, you can see the policymaker, they can see the damage that it can create from media perspective, from social media perspective. They intervene quickly with the correct information. I think that's the way to go. It's not just for COVID-19. It can benefit, of course, all immunization, all vaccines as well.
Yeah, just if I could jump in there, I think that, as John said, the public health benefit of vaccination, the stopping the spread to other more vulnerable people, has been made very, very clear during this COVID crisis. And hopefully that the knowledge that's been gained from that can be taken forward to influenza and other kinds of vaccines, because it's highly valuable there too and typically ignored.
Yeah, great point. And I mean, in some ways, control of infectious disease was a bit of the root of public health, right? So we've recentered ourselves a little bit, I think, on the necessity to not overlook that part. Okay, well, unfortunately, we're kind of wrapping up on time here, so I do want to make some concluding remarks and hand it back to the council. But maybe I just ask John and Ada, as kind of sponsors of the report and helping to guide the research. I mean, how do you guys want to see things leveraged, and where do we go from here? So maybe a couple of quick remarks from each of you.
I'll start off. Chris, those of us who have been involved know the very interesting journey we've been on so far. We're launching here, I think, a great report, and the future is obviously to leverage that report. It has got application trans-regional. There are aspects there relevant to everybody, but the more we can actually have it adopted within each country and addressed specifically in each country through workshops and the like, that's what we're aiming for.
Super. Thanks for your support, John. Ada, how about you? Last words.
I think John's covered all already. I think it's just a great start of today for the launch of the report. How to bring that journey and let people join us with multi-sector to work together and bring it into action. I think that's the most important part.
Great, and I would like to thank Janice and Professor Brian as well for your contributions. Thanks for that. I wish we had more time to keep going, but I appreciate as well the audience kind of chiming in and asking some things. So really today is just the start of continued dialogue. So please do reach out and let's keep the conversation going. I'll leave you with one kind of final thought from my own personal view on what has happened over the last 18 months, which is, we're coming into this era of what I would call health creation, right? So whereas probably the last decade or couple of decades was around health for wealth and expanding basic access and affordability to people. Now we need to think a bit more creatively about everything we do as a society and how that contributes into the creation of health and the creation of longer, healthier life expectancy. So life course immunization is one opportunity. And as you heard today, there's many facets of it that all of you listening can get involved with at a grassroots level, all the way through a corporate and government level too. So please do read the paper, engage, let us know your thoughts and comments, join the roundtables, and let's keep the dialogue going. But with that, in the essence of time, I hand it back over to the council to close things out. So thanks, everyone.
Thank you very much, Chris. A big thank you to Janice, John, and Brian as well for joining this, and of course to Ada and Chris Hardesty for the support you gave us in developing this paper. It is very important. I would encourage everybody to go and read it. You can find it at healthyagingasean.org. You'll find more information there on that microsite as well about the report. Unfortunately, we are living in a region which is aging very rapidly, even though we all think it's very young now. And rapid aging does cause issues going forward. And I think we all have a role to play in helping to educate people on the need for healthier living, on the value that life course immunization can bring to all of us, and on the roles that all the stakeholders involved, government, private sector, and the general population can play in that. So as Chris said, please do read the report. With that, I will bring this to an end. I hope you all stay safe and well, and hope we all have long and fruitful lives at the same time. Thank you very much.